Imagine this. You have a job interview coming up. You start to feel anxious about it days in advance. Your mind races with thoughts like, what if I mess up, or what if they don't like me? You may experience physical symptoms like a racing heart, sweating, or feeling nauseous. Or you're asked to give a presentation in front of a group of people. As the day approaches, you feel increasingly nervous and worried about speaking in public. Your hands shake, your mouth gets dry, and you have trouble concentrating because your mind is filled with thoughts of embarrassment or failure. Or you're invited to a social gathering with friends or co-workers. As you arrive, you feel a wave of anxiety wash over you. You worry about saying the wrong thing, being judged by others, or feeling awkward and out of place. You may find yourself avoiding conversations or seeking refuge in your phone to cope with your discomfort. Or you notice a slight ache or pain in your body, and immediately your mind jumps to the worst-case scenario. You become preoccupied with thoughts of illness or disease, constantly Googling symptoms and seeking reassurance from others. Every little sensation or change in your body feels like a sign of impending doom. Yes, it's anxiety, but what is anxiety? Anxiety is a natural and adaptive response that helps us cope with threats and danger. It's a normal part of life and can be beneficial in certain situations, such as preparing for an exam or facing a challenging task. However, when anxiety becomes excessive, persistent, or overwhelming, it can interfere with daily functioning and quality of life. Anxiety disorders are a group of mental health conditions characterized by excessive and irrational worry or fear that can significantly impact an individual's life. Causes of anxiety. 1. Genetics and biology. Some individuals may be genetically predisposed to anxiety disorders. Imbalances in neurotransmitters, brain chemistry, and hormonal changes can also contribute to the development of anxiety. 2. Environmental factors. Stressful life events, trauma, abuse, or significant changes in life circumstances, such as moving to a new city or starting a new job, can trigger or exacerbate anxiety symptoms. 3. Personality traits. Certain personality traits, such as perfectionism, neuroticism, or a tendency to ruminate or overthink, may increase the risk of developing anxiety disorders. 4. Medical conditions. Certain medical conditions, such as thyroid disorders, heart disease, or chronic pain, can contribute to feelings of anxiety. Additionally, the side effects of medications used to treat these conditions may also trigger anxiety symptoms. 5. Substance use. The use of drugs, alcohol, or caffeine can exacerbate feelings of anxiety or trigger panic attacks, especially in individuals predisposed to anxiety disorders. What are 5 signs you have anxiety? Symptoms and patterns. Trouble concentrating or making decisions. Feeling irritable, tense, or restless. Experiencing nausea or abdominal distress. Having heart palpitations. Sweating, trembling, or shaking. Trouble sleeping. Having a sense of impending danger, panic, or doom. How to deal with anxiety. 1. Seek professional help. If you're experiencing persistent or severe anxiety symptoms, it's essential to seek help from a mental health professional, such as a therapist or counselor. They can provide a proper diagnosis and recommend appropriate treatment options. 2. Cognitive behavioral therapy. CBT is a highly effective form of therapy for anxiety disorders. It helps individuals identify and challenge negative thought patterns and develop healthier coping strategies to manage anxiety. 3. Medication. In some cases, medication may be prescribed to help manage anxiety symptoms. Antidepressants, benzodiazepines, and beta blockers are commonly used to treat anxiety disorders, but they should be used under the supervision of a healthcare provider. 4. Lifestyle changes. Incorporating healthy lifestyle habits, such as regular exercise, balanced diet, adequate sleep, and stress management techniques like mindfulness meditation or deep breathing exercises, can help reduce anxiety symptoms. 5. Avoid triggers. Identify and avoid triggers that exacerbate your anxiety symptoms whenever possible. This may involve setting boundaries in relationships, limiting exposure to stressful situations, or avoiding substances that worsen anxiety. 6. Social support. Seek support from friends, family members, or support groups. Talking about your feelings with trusted individuals can provide emotional support and help you feel less alone in your struggles. 7. Mindfulness and relaxation techniques. Practice mindfulness meditation, progressive muscle relaxation, or yoga to calm your mind and body and reduce feelings of anxiety. 8. The 3-3-3 rule for anxiety. It's an easy technique to remember and use in the moment. It's available to us the majority of the time, and it can be a simple strategy to help us focus and ground when anxiety overwhelms. Put simply, you name 3 things you can see, name 3 things you can hear, and move 3 different body parts. Remember that managing anxiety is a journey, and what works for one person may not work for another. It's essential to explore different strategies and find what works best for you. With the right support and coping mechanisms, it's possible to effectively manage anxiety and improve overall well-being.